Welcome to the ITLS Case-Based Learning Scenarios Orientation and How to Use webinar. During this webinar, we will be reviewing the case-based learning scenario documents that are available to download from the website. There are some chapters that have been doing forms of case-based learning for years. ITLS recognized its value and decided a consistent form of case-based learning should be developed and made available to all chapters and training centers. The editorial board created a work group to develop case-based learning scenarios that are more interactive and learner-centered. ITLS is an international organization with more than 100 chapters and training centers that vary from being well-established to newly formed or still under development. The diverse experience and available resources were taken into consideration in the development of the new material. Change can be difficult and sometimes met with resistance, so it was important the new product is a logical progression from what ITLS has been doing. We incorporated some of the best practices from multiple chapters and training centers to develop a product that is new, refreshing, efficient, and effective. Additionally, international considerations had to be taken into account. It is important the new product is easy to distribute, is available in a format that can be translated, and when copied or printed in black and white is clear and easy to read. The Case-Based Learning Scenarios Guide is a PDF document with multiple navigation tools. Let's take a brief tour of the main document. Using a PDF reader, such as Adobe Acrobat, you can scroll from page to page, If you open the navigation pane, you can select to view thumbnail images of the pages and move through the document by selecting a page thumbnail. Or you can select bookmarks and navigate through the document by selecting a section title. Additionally, the table of contents is hyperlinked to the indicated sections. Now, there may be some variation of functions depending on your operating system or PDF reader. One of the first things you may have noticed is the documents are in a landscape layout. This provided better options and function. The document provides ITLS instructors with some background on case-based learning, a description of new ITLS scenarios, and the evaluation rubric. All available scenarios are included in the document, but this is a living document and will periodically be updated when additional scenarios are developed. Case-based learning may be new to some, so we provide a brief description of case-based learning, its objectives, and some attributes and challenges with using it. ITLS cases will be provided in 2 banks or libraries for instructors. The Practice Bank provides instructors with a selection of practice scenarios that are designed to build learner knowledge, skill, and critical thinking through a case-based learning experience. 2 sets of 10 practice cases have been released, with more slated for future release. The Testing Case Bank has not yet been released. These scenarios will provide instructors with a selection of testing cases that will evaluate the student's knowledge, skill, and competency gained through the case-based learning experience. As the name suggests, the Practice Case Bank should be used during Skill Station practice, and the Test Case Bank, when released, should be used during the final practical exam. Each scenario consists of 4 primary pages: the synopsis, assessment, expanded content, and the patient monitor. The synopsis page provides the foundational information the scenario is built around. Even without the remaining scenario pages, many experienced ITLS instructors would be able to provide learners with accurate assessment findings and appropriate interactive discussions and questions. The upper portion of the synopsis page consists of a scenario name or patient type and a scenario number. The number reflects the scenario set number, 1, 2, etc., practice versus test, as in a P or a T, and the scenario number, 1, 2, 3, etc., of the set. This scenario is from Practice Set 1, Scenario 4, and is a geriatric trauma. Two different scene settings are provided, in EMS pre-hospital and in occupational health and industrial. ITLS has a separate course for the high threat or the military environment that have their own dedicated scenarios. Therefore, there is not the need to include that environment in these cases. Learning objectives and key points are provided. These are used to develop the scenario and should be reviewed by the instructor to ensure all objectives and key points are addressed. A sample history and patient injuries are provided to help the instructor set up the scenario. On the lower portion of the synopsis page, you will find the Assessment and Intervention Synopsis. This is the anticipated performance of expectations of the team leader and the team. Please note, there is a multitude of potential patient interventions and resulting responses. It is the responsibility of the instructor to ensure reasonable and realistic patient responses are provided to the interventions. Patient instructions and moulage instructions are described to help the instructor set up the scenario. The assessment page provides the early patient assessment findings. The upper portion of the assessment page provides information for when the learner first approaches the patient and begins the primary survey. To enhance learner engagement, recommended questions are provided throughout these pages. You may direct the questions to the team leader or team members. This interaction will help you assess the learner's knowledge and ensuring all the scenario objectives and key points are addressed. The lower portion of the assessment page provides information for the various types of assessments that may be performed. The information is designed to be read top to bottom of each column and then a logical progression of the assessment types from left to right. Please note, in the 9th edition of the textbook, the ongoing exam has been renamed Reassessment, and these scenarios have incorporated the new term. The upper portion of the expanded content page provides initial vital signs in the far left column and follow-up vitals in the far right column. The transport and intervention columns provide questions based on anticipated progress. The lower portion of the expanded content page provides questions relevant to the type of assessment performed. An area for additional questions is provided to ensure all scenario objectives and key points are addressed. The answers provided for all recommended questions currently are referenced to the 8th edition of the textbook. The Patient Monitor page provides a static view of the patient-specific ECG, pulse oximetry, capnography value, waveform, and vital signs. The information is usually based on the initial vital signs provided in the scenario. The most common exception to this is a stable patient, when a monitor would likely be applied during the secondary survey. Additional monitor displays may be provided to represent significant changes after interventions or additional diagnostic information such as a 12-lead ECG. We are now moving on to the scenario evaluation portion. ITLS chose to use a rubric for guiding learner progress and evaluating their performance. The ITLS rubric facilitates fair and accurate assessment, fosters understanding, and defines the pathway for subsequent learning and teaching. Learners may also use the rubric as a basis for self-assessment, reflection, and peer review. Before going over the rubric, it will be helpful to clarify what we mean by the terms competent and proficient. Competent refers to the bare minimum required for acceptability. Competent lives in a yes-no framework. It's a very objective observation. One is either competent or not. If they are not competent, their performance is inadequate and requires remediation. Proficient carries with it a level of mastery that is above the minimum and is a degree of competence or expertise. Proficient lives in a sliding scale framework, a subjective observation, where one can strive to be more proficient. Using the evaluation rubric does not change the ITLS standards or expectations for grading, just the tool has changed. Instructors still have the same amount of discretion in grading. Using the ITLS Scenario Evaluation Rubric is a significant departure from grading sheets of the past. Again, the ITLS standards or expectations for grading learners have not changed, just the tool has. The ITLS Scenario Evaluation Rubric consists of objectives and levels of achievement of individual objectives using defined criteria. The ITLS rubric uses 3 levels of achievement with scores ranging from 1 to 3. Due to space limitations in the criteria, the terms initial assessment, rapid trauma survey, and focused exam are abbreviated to assessment, survey, and exam. A score of 1 indicates the learner did not achieve minimum competency in meeting the objective. A score of 1 in any objective indicates remediation is needed and additional documentation describing the inadequacy. This could also be described as a critical fail. A score of 2 indicates the learner achieved minimum competency in meeting the objective. This does not mean every step of all the assessments or all possible interventions have been done. At the competent level, they need to at least identify all critical injuries and have all necessary interventions done for the given scenario and available resources. A score of 3 indicates the learner achieved proficiency or mastery in meeting the objective. Deciding between a score of 2 or 3 may be difficult and could be considered a very subjective determination. When scores are totaled, an overall rating of performance is determined. Again, a score of 1 in any objective indicates remediation is needed, along with additional documentation describing the inadequacy. Any score of 1 could be considered a critical fail. Additional clarifications of the criteria and standards used in the rubric are provided. You may have noticed there are no objectives that address critical times. Our standards are: the primary survey should take less than 2 minutes for critical patients. Critical patients should have a scene time of less than 5 minutes, and the reassessment exam should be every 5 minutes on all critical patients. Not having objectives for critical times does not mean times are not important. If time frames are unnecessarily exceeded, this would fall under the team management objective, where they did not demonstrate competency in coordinating team members or resources to perform tasks or meet objectives. ITLS also provides the evaluation rubric as a fillable PDF document. By using a PDF reader, you can score students' skill performance electronically. This will enhance documentation and minimize input errors. It also allows electronic saving of individual scoring rubrics for course files. You do not need internet access to use the rubric. You may save the file locally to your device for use offline. To use the fillable document, open it in a PDF reader. We are using Adobe Acrobat Reader. The shaded areas indicate fields for you to provide data. By moving your cursor over the small question marks in the objectives, an information window will pop up with the same clarification criteria previously discussed. Select the field you want to edit and type in the information. You can cursor click or press Tab to move to the next field. The only valid entries in the score fields are 1, 2, 3, or leaving it blank. An error message will pop up letting you know if you have an invalid entry. The form automatically calculates the total score. When you have completed your documentation, you may save the form. Click on the Save Form button at the bottom of the screen. Indicate where you want the form saved and rename it. Consider using something with a team leader's name in it. When you are returned to the form name at the top of the screen is the new name. This is why it is important to save the completed form with a different name. Press Clear and you're ready to do another. A word of caution, using a fillable PDF may be quirky, especially if using it with an app on a tablet computer like an iPad. If you have problems, please contact us and we will try to resolve them. The case-based learning materials are accessible to all and can be found under the Instructor tab at itrauma.org. No sign-in is required, and you do not have to be an ITLS instructor to access these materials. Because these are practice scenarios and not used for testing, there is unrestricted access. We thank the Scenario Development Workgroup for their commitment and tremendous amount of contributions to make the ITLS Case-Based Learning a reality. The ITLS Editorial Board, Board of Directors, and staff from the International Office have also been very involved in this product. In addition to overall guidance and support, they did a final review of the released material. Additionally, an independent review was also completed. The independent reviewer had no knowledge of ITLS and provided an unbiased, objective review of the educational structure, logic, and content of the material. In summary, ITLS believes in the value of experiential learning to strengthen learner understanding of core concepts and transition the learner from a basic knowledge to mastery of trauma assessment and skills. Clear case objectives and learner expectations are provided to ensure learners benefit from consistent case delivery. Instructor-guided discussions reinforce key concepts throughout a case and is designed to increase learner success. The ITLS Case-Based Learning Scenarios and Evaluation Rubric are packaged into a single PDF document with bookmark, page thumbnail, and hyperlink navigation features. This is a living document that will periodically be updated with additional scenarios. This is an open resource. No sign-in is required, and you do not have to be an ITLS instructor to access these materials. A date for required implementation of the ITLS Case-Based Learning format has yet to be determined. Notification with adequate lead time will be provided. Incorporating the case-based learning materials into your courses should be under the guidance of your chapter or training center. Questions relating to the use of case-based learning may be directed to your local chapter, training center, or ITLS International. Questions generated from the live webinars are posted on the International website under Frequently Asked Questions or Possible Solutions for Evaluating Challenges. This concludes the overview, orientation, and use of ITLS case-based learning scenarios. Thank you, and we look forward to your feedback.